Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Stephen Tafor. He is board certified in both pain management and anesthesiology and also fellowship trained in pain management. And today we're going to talk about his practice in Central Georgia. Dr. Tafor, thanks so much for being with me.
Thank you so much for having me. I appreciate it.
Would you let our viewers know a little bit about your training as an anesthesiologist and then how you moved into pain management specifically?
Certainly. After completing medical school, had a residency training in anesthesiology, which is a 4-year program. And after that, I did a 1-year fellowship in interventional pain management. And that brought me into the world in which we are right now.
And what is it about that specialty that you were attracted to?
That's a very good question. Like we all know, pain is a very common complaint that patients give to their primary care physicians, even when they go there to see them for other conditions, high blood pressure, diabetes, or whatever. A good number of patients do have pain as a existing complaint as well. And having been in the healthcare field in the past, working as a therapist, I also saw the impact that chronic pain had in patients, and I thought if there was anything I could do to alleviate some of that, that probably would be something quite beneficial, both to me as rewarding as it is to see pain relief, and also to the patients, hopefully.
When a patient is referred to you, or by the time they get to your office, what kinds of other treatments have they exhausted normally?
A lot of patients, by the time they get to us, have seen their primary care physicians who have referred them to physical therapy. Sometimes they've had massage therapy. Sometimes they've seen chiropractors. Sometimes they've even tried other medications, NSAIDs, Tylenol, and stuff like that, without much improvement. Some patients also do come to us from surgeons and are not surgical candidates, so we get a good variety of patients.
What would you say, if you categorize them, are the types of conditions that people present with?
Most often patients presenting with pain in the neck, pain in the lower back. Sometimes it could just be joint pain, meaning pain in the hip joints, pain in the knee joints, and also not too uncommon, pain due to cancer. So that's a big variety of pain complaints that we get when patients present to us.
When a patient first comes to you, what's a typical office visit like for their first visit?
Yeah, when a patient presents to us for the very first visit, hopefully before they actually get to the office, they would have already had paperwork to complete, to give us an idea of what's been going on with them, how the pain how the pain has affected their lives, and a lot of that information that is provided to us before their visit actually helps us to put things together to make sure that we're ready to see them with when they actually present. So when they come in for their very first visit, they get checked in and their vital signs get taken, and we get the history of present illness, and then we go from there.
Are there other types of diagnostics that patients need to have prior to coming to you, like radiologic diagnostics or blood work or any of those things?
In most cases, yes, but not in every case. Not in every case. Majority of patients who come to us already have MRIs or CT scans, or sometimes X-rays of their joints. If those imaging studies are already there and recent, then we probably don't need anything new. Some patients haven't had those studies, so we typically order those when we see them for their first visit.
So say once a patient comes in, you've taken their history and you determine their course of treatment. What are some of the typical treatments that are used in pain management that you use on a daily basis with patients?
So the treatments that I would administer myself, that is assuming that they've already exhausted all other therapies, treatments that I would administer myself sometimes in the clinic might just be something as simple as muscle relaxants, medications. If spasms is what is really the main cause of their pain. Sometimes we do injections, interventional injections, patients call them pain blocks. They have several names for them. You have epidural injections, you have facet joint injections, you have SI joint injections. We also do some slightly more invasive treatments, like spinal cord stimulation for mostly patients with what we call failed back surgery syndrome.
Mm-hmm. And you mentioned some of the medication piece, so you're treating both muscular pain and or bone pain. So treat both?
Correct. So, pain presentation can be very varied, and given based upon their presentation and what we find in the physical exams, sometimes there might be something as simple as pain that is emanating from bones, and those usually respond well to NSAIDs or anti-inflammatory medications. Sometimes it might be spasms, sometimes due to bad posture or due to some what we call freak injuries. Sometimes we see those with athletes, and some of those pains might resolve with just simple medications. Yeah.
Do you think of the progression of pain management in terms of medication and then intervention? Does it progress like some people go to physical therapy, then they go to surgery, or is it always a combination of those? It's not necessarily escalating to injections.
I think one way we pride ourselves at the Hemlock Pain Center is that we believe in tailoring the treatment to the patient and their presentation. Some patients might only need a referral to physical therapy. Mm-hmm. Some patients might benefit from physical therapy but don't necessarily get all the relief or the degree of relief that requires them to return to normal function. They might not be good candidates for medications. They might just be candidates for interventions like injections, and so it just depends upon the patient's presentation and what our findings reveal is best suited, to improve their condition.
Mm-hmm. When it comes to pain, it's a very interesting question about what is pain for you or what is pain for me. If a viewer is watching, where do you put pain on the scale of the time to call someone for a pain intervention? What's the description of that like? Not necessarily the pain scale, but where does pain intersect with needing to come to a specialist?
Mm-hmm. Most patients that we see are patients who have already failed conservative treatment. Mm-hmm. So by the time they come to us, they probably have struggled with their pain for, on average, is 3 months at least. On average, is 3 months. Mm-hmm. And part of the reason is because they've tried some other simple modalities without success. Mm-hmm. So by the time they come to us, they've already exhausted what they have available to them, and so that's when they present. Also, sometimes some primary care physicians do a very good job in trying to alleviate the pain, because acute pain would resolve if the inciting injury is taken care of. Mm-hmm. So sometimes patients, you could have a pain that seems to be troublesome and seems to be quite severe, but within a few weeks or months, it usually goes away. And so those patients don't come to us. When a patient presents to us, they're probably at the end of the wits. I mean, they're throwing their hands up. I don't know what else to do. Can you help me? And these are patients who are not responding to just traditional, typical, non-interventional options, I'll say.
So if pain is disturbing your sleep, it's disturbing your regular activities, it's disabling, is that the time when patients should come, when it isn't a resolution of an injury, it's just ongoing disruption of average daily activities?
That is absolutely correct. That's typically when we see patients presenting, because their recreational activities have been hampered. Some of them cannot work, some of them cannot return to work because of the pain. Some of them just have difficulty taking care of their loved ones at home, or just cannot do their regular activities of daily living. When it gets to that point, then they usually will seek our help.
So if someone's watching today and they want to know how to get in touch with you, do they need to come through a primary care physician, a surgeon, physical therapy, or are some able to call you directly?
All of those options actually are very good options. And the reason is because we really like to coordinate their care with someone else. I think it's always good for more than one sets of eyeballs to to be taking a look at the patient. But if a patient hasn't seen a primary care physician of late and they've tried everything to their best without getting relief, and they contact us, we can contact the primary care physician and actually request a referral. So we do have some patients who actually, because of successful treatment, want to refer their own family members, and sometimes, we go that route as well.
Well, thanks so much for telling us more about your practice.
Well, thank you so much for having me. The pleasure was ours.
Well, thank you. And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Tafor and his practice, please visit us at atriumhealthnavicent.org.